Dear DTRF team, I'm very pleased to present the result of this prospective study assessing the prognostic value of S45F mutation of beta-catenin gene in Desmoid type fibromatosis. As you know, Desmoid type fibromatosis is a proliferation of monoclonal fibroblast-like cells with unpredictable course. There is an accumulation of beta-catenin due to two mutually exclusive mechanisms, germline APC mutation in about 10–50% of cases, and more frequently, somatic beta-catenin gene mutation in about 85% of cases. There are three hotspots in beta-catenin gene, including S45F. There is no recurrent molecular alteration that could explain the unpredictable course of desmoid tumor, excluding beta-catenin gene mutation. There is a debate about the prognostic value of S45F prognostic value. After surgery, a large meta-analysis of more 300 cases show that S45F mutation is a poor prognostic factor for local relapse-free survival in univariate analyses. More recently, Japanese colleagues have shown that S45F mutation is a poor prognostic factor for relapse-free survival. Currently, there is no data about prognostic value of S45F mutation in case of active surveillance. After systemic treatment, S45F mutation seemed to be associated with better outcome after administration of imatinib, methotrexate vinblastine, or oral vinorelbine. So we have used the data from Altitude trial to assessing the prognostic value of S45F mutation. Altitude trial is a prospective nationwide study of incident cases of desmoid tumor. Patients have been enrolled from January 2016 to December 2020. There was a central pathological review with biobanking. The eligibility criteria for the present study was unifocal desmoid tumor, treatment by active surveillance surgery of systemic treatment, and availability of beta-catenin gene sequencing result by NGS or Sanger sequencing. The primary endpoint for this study was event-free survival, including relapse after surgery, progression in case of HER2 resection or active surveillance, death, or censoring in case of starting treatment without documented relapse or progression. This is a flowchart of the study. We have excluding patient with multifocal tumor, patient treated with other approach, excluding active surveillance, surgery, and systemic treatment, and case with missing data about beta-catenin gene mutation. At the end, we have returned 82% of all patients, including in Altitude trial. This is a result of beta-catenin gene molecular alteration. We did not find any beta-catenin gene alteration in 15% of cases. We found a beta-catenin gene mutation in the 3 hotspots in about 80% of cases. And we found a rare beta-catenin gene alteration in less than 5% of cases. This is the patient and tumor characteristic at diagnosis. As you can see, there is 28% of male. The median age at diagnostic was 40. 1/3 of tumors were located in abdominal wall. The median tumor size was 50 mm. Most of patients had very good performance status and no pain at baseline. And the first-line therapeutic approach was surgery in 23% of cases, active surveillance in 68% of cases, and systemic treatment in less than 10% of cases. In this table, you can see that the patient and tumor characteristic of patient with PS45F mutation is not balanced compared to other tumors. PS45F mutation was statistically associated with male gender, non-abdominal wall primary site, tumor size. The tumor associated with S45F mutation were larger, and pain. There is more pain in case of PS45F mutation. This is the event-free survival curve after a median follow-up of 24 months. We have seen 129 events, including 3 deaths. The 2-year event-free survival was 70%, and the 3-year event-free survival was 66%. In this schema, you can see that PS45F mutation was not a prognostic factor for event-free survival. The 3-year event-free survival of tumor harboring PS45F mutation was about 50%, not statistically different from the other desmoid tumor. The multivariate analyses show that the 2 prognostic factors for event-free survival was tumor size and first-line therapeutic approach. There is more event in case of active surveillance and systemic treatment compared to surgery. It's expected since systemic treatment was used in case of very aggressive tumor, and active surveillance aimed to identify patients with progressing desmoid tumor. In opposite, beta-catenin gene molecular alteration was not prognostic factor for event-free survival in multivariate analysis. To conclude, 13% of desmoid tumor harboring PS45S mutation. This mutation was statistically associated with male gender, pain, non-abdominal wall location, and larger tumor. This particular mutation was not prognostic factor for event-free survival. The 2 major prognostic factors for event-free survival were tumor size and strategy. Today, there is no biomarker predicting outcome of desmoid tumor. The major threat of this study was its prospective nature, the fact that we have enrolled all comers, and the fact that most of patients are managed by active surveillance. The limit of this study was the fact that beta-catenin mutation analysis was not centralized, and we have to better describe the quality of surgery, R0, R1, and R2 resection. I would like to thank the patient and the family, the investigator and CRA of the 31 participating center, the French Sarcoma Group and co-author, the founder, la Ligue nationale contre le cancer, Intersarc et l'Institut Curie, and the French advocacy group, SOS Desmoid. Thank you for your attention.